Let's bring on our next speaker. I see him here in the background, Larry Diamond. There he is. Larry, how are we doing today?
Doing real well, Spencer. How are you?
Doing fantastic. I see your slides. Let's get them on the screen here. Whoops, sorry about that. There they are. All right, Larry, the floor is yours.
Good afternoon, everybody. I'm Larry Diamond, the CEO of Mitesco. Thrilled to be here today. It's always exciting to be at the presentations. Would love to do this in person, but hopefully in a couple more months we'll be past the pandemic. Like everyone else who's presented today, we are going to be talking about forward-looking statements. So we have this warning and attestation with regards to that. To get right into the presentation, Mitesco, we are a OTC traded company, have been around since 2009. In 2015, we recognized that healthcare has become a consumer product. For all too often, healthcare has been organized for the convenience of the providers. And with the abdication of the insurance industry putting such large amounts of dollars back in the hands of consumers with co-payments and co-insurance, so many segments of healthcare have really focused on the consumer. And we're no different. We have looked at primary care, recognized that primary care is probably the single most powerful tool to control healthcare costs in America, which now accounts for about 1/6 of GDP. Primary care, for every dollar that's spent there, typically see about a $13 reduction in the cost of care for the individual who's going into primary care. So we opened a innovative nurse practitioner-led primary care clinic in February of this year in Minneapolis. Nurse practitioners, from a practice of medicine perspective, have the full scope and authority of practice to use their full education, the same as any physician. And the advantage is that an NP very much is focused on longitudinal care. From an educational, they embrace whole person health. And as a result, they look to build and solve problems in partnership with patients over time, which is exactly what our country needs, facing the challenge associated with chronic illness. At this time, we have 3 clinics that are open and operating, all in Minneapolis. And we have unique in the marketplace is the AMA shows that we have about a 25,000 provider shortage of primary care providers in America. Our model is delivering one of the few sources of net new capacity. So whether you're an insurance company, a narrow network insurance company, a self-funded employer, and you're looking for some way to get your people into primary care instead of having them self-direct to specialists or going to retail care, which unfortunately typically doesn't solve the whole person's problem, we are the answer. And as a result, we are getting approached by numerous insurance companies to be added to their networks so they can increase the capacity and really focus on the outcomes-based reimbursements and incentives that the government is putting out, as well as the insurance companies are offering today. The consumers have spoken very loudly with regards to what they are happy with and what they're not happy with. 81% of consumers today are completely dissatisfied with their healthcare experience, and 80% would shift simply for added convenience. And so when we sat down and looked at how do you build a better primary care practice, we said there's lots of tools out there. The market has devices, they have disease management programs, there's applications. It is not one size fits all. You have to look at all these, you have to build a program that's unique to the patient's needs. And that's what we do is we look at these in partnership. We look at supplements, we look at behavioral health, we look at dermatology, and we wrap that all into a package for individuals. And we've come up with this model called the Good Clinic. It is located, the clinics are located typically in high concentration residential areas. Our first 3 clinics that we have opened are actually on the retail strip of high-rise apartment buildings. So we're working with Lennar and a bunch of other developers to locate these clinics. They're relatively small, about 3,000 square foot in size, keeping our costs down and allowing us to fit inside of these high-density residential locations to keep the access and convenience paramount for the individual to come in and to work with a provider. We focused on minutes of care that we deliver, not visits per day. And so the insurance industry has embraced this concept, and our typical appointment is going to be about 45 minutes with the consumer, really understanding who they are and working with them and to address their problems. And so when normal primary care has operated in America, we typically have seen about a person visiting their primary care doc about 1.5 times a year. We actually are expecting to see a person 4 to 6 times a year so that we can follow up and make sure that they're staying on focus on the plan that we've worked and put together in partnership with them. Now, the neat thing is because of COVID, people have accepted virtual care. And so we actually anticipate that half our visits will be virtual. Each of our exam rooms is set up to facilitate virtual care or see the person right there in the bricks and mortar. So we're very flexible to be able to adjust to what the customer wants and how they want to interact with us. And this partnership really allows us to work with them to help them achieve their goals based upon their unique conditions, whether they're sick or whether they're just trying to improve their health. The interesting thing is it's important to remember 70% of Americans on average use less than $2,000 a year in cost. Why is that important? As we're building out practices, this is the time that people are most mobile. They don't have relationships with their physicians, and as a result, they're very willing to consider something. And you saw the market research that shows that 80% are willing to move just for convenience. Well, that's us. We're right there in the apartment complex. What's interesting is that the developers see us as an amenity, just like the swimming pool or just like the gym. And so we're getting favorable rents inside these buildings. The nurse practitioners on average cost about 40% less than doctors, and our reimbursement is 15% less. So that gives us an extra 25% margin for the clinic to operate and produce results for the shareholders. From a consumer perspective, we very much focused on their experience, and I'm going to show you a picture of what a clinic looks like. But we really focus on the expertise, education, and empathy, understanding who they are, what they need, and delivering to their unique needs. We focus on activation. Activation is a science that came out of University of Oregon. It actually defines the 95% confidence level, how good of a consumer someone is when it comes to healthcare. And as a result, it actually tells our clinicians how to work with them. So whether to be at a very basic level or to be at a very sophisticated level. And that really improves our ability to work with them and get them to participate and follow the recommendations that we're providing to them. Additionally, lifestyle integration. People will only do what's easy. So when we build that plan in partnership with them, it really is focusing on making sure that that's going to fit into their lifestyle. So our model in what we're doing, we've talked about a bunch of these, but really it's lowering the cost of client acquisition because we're right there, part of the community. We work in partnership with people. We just don't give orders to them. We understand what they need, and we work with them to achieve those goals over time with several visits during the year. It's all based on science. We're using a lot of the tools that are out there to be able to predict what folks need, who's going to be sick, those sorts of things, which is becoming very popular in healthcare today. And from a revenue perspective, because we're there, because we have a plan of care, just like veterinarians do, your dentist does with follow-up visits, we're able to work with people cost effectively and keep that relationship and revenue coming into the clinic. This gives you a look of what one of our clinics. Each of our clinics is basically the same look and feel. So like any organization that you see has a common franchise or brand, we have built that same good clinic promise. So we train our clinicians based upon the good clinic consumer experience. We focus on selling front store items to make things convenient, whether it's OTC products that we have, nutraceuticals, supplements, educational materials. So we're actually generating additional revenue beyond what is getting reimbursed in insurance or from cash pay customers. We will finish the year somewhere between 6 and 7 clinics open. 5 of those clinics will be in Minneapolis. We've already started construction of our first clinic in Denver, Colorado. You can see the numbers here. You know, we're opening 10 to 15 here in Minnesota, 12 to 20 out in Colorado. We will then move on to Arizona and to Florida and be opening clinics. Our goal is to open 50 clinics over the next 3 years de novo, so we're going to build those. And then we're also looking for acquisitions to build out the overall business. When we look at the landscape and what's happening from a competitive perspective, obviously there's telehealth only businesses out there. There's retail health. These are both very viable businesses. We think that's not the best way to deliver care, because without the medical record, some of those times the interventions you're recommending to consumers are going to be not the right thing. When you have the medical record, when you have that relationship and you have the ability to do walk-in and virtual, we think it rounds out and offers the best experience for the consumer. Concierge medicine is a great alternative, and we will pursue concierge medicine, but we're going to do it a little bit different than most, in that we're always looking for an aggregator, whether it's a union, whether it's an employer. And the key to that is to avoid adverse selection. Well, my experience tells me after 27 years in healthcare, if someone pays for something themselves on a monthly basis, they will use it. And so it's really important to have that aggregator if you're going to be able to operate a program like concierge medicine on a profitable basis. So for us, we're really focused on the consumer. We're looking at insurance companies to be aggregators for us and work in partnership where they're paying us for performance. We've already been invited into some of the outcomes-based, or commonly called ACO networks, based upon what the insurance companies see as our approach to care. All too often, primary care has been used as a filter system for healthcare systems to find the high-cost events, things like angioplasties and stent placements. We're focused solely on keeping people stable and healthy in place and keeping on in a relationship to improve their quality of life. We focus on prevention, and we're net new capacity in the marketplace. Talked a little bit about, we are looking for acquisitions of other physician practices where they're going to retire. So I do expect that we will be able to increase the number of clinics over the next 3 years beyond the 50 that we plan on building de novo. I'm going to go ahead and move to questions now. Here's some slides. You have the slide deck available. We've been able to have the clinic here. The team that built Mini Clinic and sold it off to CVS is the team that's currently operating and building the Good Clinic. They took all their learnings and put it together. Additionally, what's unusual for our organization, we have a very experienced management team and board, and you can take a look at that. And our highlights are very simple. You know, today our peer group is, One Medical, Oak Street Health, Iora Health. These are all companies that have gotten unicorn valuations. Because we're on OTC right now, we're probably not as efficient of a marketplace, and so our value is not fully recognized. And we are in the process of moving towards an uplist to the NASDAQ. And I think it's a tremendous opportunity for our shareholders to realize the efficiency of the NASDAQ versus where the OTC is today. So let me go ahead and ask see if there's any questions out there.
I guess, Larry, not that you can get specific here, but maybe if we work backwards, when did you initiate the uplisting proceeding, just to give people an idea of how long that might be? I know you can't give guidance on when it's going to happen.
Yeah, so we've started the process to go through the steps. What we're expecting, NASDAQ is a little backed up, so we're optimistic it will still happen this year.
Okay.
But it could happen it could fall to first quarter based upon what we're being told by the NASDAQ.
Got it. Of all the things that you just talked about, what's the opportunity that excites you the most?
The real opportunity is to help consumers take more control of their lives. The science of activation gives an unfair advantage to our clinicians to understand exactly how to work with the consumer, to help them be better users of healthcare, to reduce healthcare costs.
Yeah.
And the unique approach of using nurse practitioners, which cost less than doctors, having that margin and that extra margin in there really gives a unique opportunity for for our shareholders to be able to see the value and appreciation and growth of the company.
Do you have expectations for what M&A? I don't know. Demand is not the right word, but supply maybe is a better word for what that could be like with retiring doctors' practices.
Well, in addition to the 25,000, primary care physician shortage in America today, there's a huge number of doctors who are retiring over the next 5 years. It's tremendous. I don't know the exact number, but the opportunity to solve that problem in America, especially as we're looking at what percentage of healthcare being 1/6 of GDP. So, and we just can't invest enough in pharmaceutical and device technology to control cost of care. We need consumers to take an active role, and our nurse practitioners are the ideal partner to help them do just that. And so we're seeing, right now we have 5-star Google ratings across the board. Consumers are really enjoying what they're experiencing with us. And so, that value that we're already seeing in the marketplace is pretty significant.
I guess my question was more, you anticipate the number of acquisitions via or as a result of retiring doctors accelerating or decelerating or staying about where it's at right now?
The reality is it's accelerating, and it's exacerbated by the fact that very few physicians actually want to go into primary care. And that's one of the challenges. So the demand for primary care practices being purchased by other physicians has basically dried up. And yes, a lot of the insurance companies like United Healthcare have bought a lot of the physician practices, but for the ones they haven't bought today, there's not a big market. So the reality is, in a city like Arizona, I think there are more doctors retiring than there are entering the practice.
I was not aware of that. We have time for one more. Let's take this one from Roy in the chat. Your goal of 50 clinics in 3 years, to Roy's eyes at least, seems aggressive. How realistic is that you will need additional administrators, real estate, or even funding for that matter?
Yes to all those. So we've been able to build a partnership with Colliers, one of the largest real estate management companies in the world. So they're representing us on securing leases for our properties. Michael Howe, who comes out of the restaurant industry before he built Minute Clinic, has been able to use paneled wall systems. And so we actually go from building permit to CO in about 10 weeks. So identifying the properties, we have a great partnership and are working very quickly through that. We build them very quickly. And because of both nurse practitioners much prefer to practice independently than under the tutelage of a physician. And so with the recent law changes that have been occurring over the last 5 to 10 years, giving nurse practitioners full scope of practice, it's an ideal time to be able to stand up 50 clinics very, very quickly. And, we're starting off here with 7, which is pretty good for a brand new company. And we expect that we will achieve that 50 over the next 3 years.
All right, Larry Diamond, CEO of Mitesco, thank you so much for hopping on today on the Benzinga Small Cap Healthcare Conference.
Thank you, everybody.
Thanks a lot.